Good morning, friends. Today I'm going to invite one of my friends, Mark from South Africa, who will be joining us to give us a little insight on what's happening in South Africa, but also we may talk about some dentistry. He's really a master at digital smile design. So let's see if, hello, Dr. Costin. Mark is on. Great. Yeah, one of my patients. Hello.
Here we go. Amazing.
Hey, you're
Good, man.
here.
How are you?
I'm good. So what time is it in South Africa right now?
So it's 6 o'clock in the evening.
In the
So
evening.
it's
Okay.
kind of we've had a whole day to contemplate. It's been it's been our first day of staying at home,
Oh, it
lockdown,
is.
whatever we want to call it,
Okay.
reconciliation, or what I think. It's been our first full day, so we've had some time to sit down and think about the world.
What is the situation right now in South Africa with coronavirus?
So, I think that the one thing that I've been thinking about so much is that, for so long we became, I think, a disjointed kind of community. I know we have lots of things in common like social media, but
Right.
I think this virus, this situation has really made us think that we're on this planet together. We're in
Right.
it
We're all
together,
humans.
and
Yeah.
yeah. And we need to start thinking like that again. It doesn't matter which corner of wherever it is you're from,
Yeah.
but we have common problems, that we need the solutions from whoever has them. Sharing is caring, I suppose.
Hmm.
So anyway, I think that, in South Africa, we had to take a really strong decision because we have different problems in our country as opposed to obviously to sort of, the European situation.
Hmm.
And so we are in now the lockdown situation that so many other countries have faced.
Yeah.
I think we're finding out, day by day. I think we need to kind of take it in a way where we can digest things rather. Don't think too far ahead. Really think about it, for today and work out tomorrow.
So has this is
So
the first day that your practice is closed? Or has your practice
no,
been
so
closed
so
for a
I
little bit?
closed my practice. I closed my practice already a week ago.
Okay.
We were really, I think, I think we were really relatively early in the whole kind of Corona curve.
Yeah.
Um, but we don't really have similar situations to some European and first world countries. We have
Right.
problems that we felt, I believe, we needed to deal with in a kind of more positive way. And also we've had information, obviously what's happened in other countries, where the mistakes have been made,
Right. Yeah.
and
Learn from
so
everybody else's
learn
mistakes,
from
right?
everyone else.
Yeah.
Sharing this information is going to be the key going forward. There's no question.
Yeah.
So we closed a week ago, and today is the first day that we have now a proper lockdown situation in the country.
Okay. So before we get started more, why don't you
Yeah.
introduce yourself to, my
Okay.
followers so that they know who
All
you
right.
are if they don't?
Okay. So I'm obviously a dentist, and I'm happy to be one of those. By the way,
Yeah.
I really love what I'm doing, and I love what I've been doing for so many years. I qualified back in 1981, and I joke when I give lectures because the reality is most of the people sitting in my lectures weren't even born when I qualified, which is probably you, by the way.
No, I was born in 83, so
Okay.
yeah, 8.
And so, I'm pretty passionate about dentistry. I lived for many years in Europe, in London, and about 15 years ago, I decided, to head on back home. And I started a practice, and I've tried to, over the years, be very focused on certain things in dentistry that allow me to be a better dentist, than really trying to do a lot of stuff, averagely. So I've really focused on things. I've set myself goals, and you know, without being above anyone else, I think that we really, or certainly myself, have got to a point where, you know, giving back is one of the most important things for me. So
great.
I run a restorative cosmetic practice in Cape Town. I'm part of a teaching academy with probably a lot of your followers also know Howie Glackman.
Yeah.
The Implant Aesthetic Academy. And so I mix my time up in terms of clinical dentistry in my practice, which is enamel dentistry, and
I love your logo, by the way.
Yeah, lecturing around the world a little bit, and yeah, focusing on education, dental education.
Yeah.
So, and my
Great.
passionate, smile design, and cosmetic dentistry, I suppose, is my focus, my key that I kind of have spent all my time on.
Yeah, I kind of think of you and Howie as like when people think of dentistry in South Africa, I think of you two guys, and I think that there's a lot of other people that think that way.
Yeah, I mean, without taking anything away from other people, I mean, we've obviously put ourselves out there, I mean.
Yeah, it helps to be around the world, speaking.
Yeah. And I think, like I say always, in order to grow, you have to put yourself a little bit out of the comfort zone, I think it's super easy just to sit behind a facade or sit behind, but I think as individuals, as organizations, I think we have to trust ourselves sometimes, and really, Eddie, you've been there, I'm sure, in that situation where you just need to do it. Trust yourself, and really, you'll be amazed. I think we all sometimes underestimate what we can really achieve as individuals.
Yeah, they say like there's no one better to invest in than yourself, right?
Yeah, sure. And I mean, listen, in dentistry, we know the most important thing is, apart from ourselves, is the people around us. I mean, these are the people that make us successful. But I agree, we have to look at ourselves, and figure out, what it is we want, and then set ourselves goals. I think sometimes we get consumed by peripheral things. So, I've really made an effort in the last like 10 or 15 years to understand this important aspect of like saying, this is what I want to do, and really try and achieve those things.
Yeah. So do you recommend for, let's say, some of my younger dentist followers that you kind of pick a niche that you like and really go into that?
No, for sure. I mean, I've said this all along to the people, the dentists who come and speak to me, dentists who shadow me, come to our courses. When I started, it was possible to do everything, but today that's not possible. And I think we have to make a conscious decision, and this is the most important path and crossroads that we will make in dentistry. And honestly, this is what I tell people. This is why at my age, and I'm not going to tell that on this interview, by the way, that I still love what I'm doing, and I have the passion.
Yeah, that's great.
Is because I decided to focus on the things that I was really good at and that I really liked, and cut out the stuff I found difficult, mostly because it didn't excite me.
Yeah.
And focus on those things, decide what it is that makes you happy. Is it implants? Is it perio? Is it cosmetic dentistry? Is it orthodontics? Is it research? Whatever it is, but focus on that one thing, and then go for it, because the sky's the limit, in my opinion.
So I talk a lot about stress on here and my lectures and things.
No, I've heard you and Simon and Christian. It's a super important thing. I think that we sit on our own, and really there's a lot of that stuff. But go on and tell me what you were going to say.
Yeah. Do you think that focusing your practice helps with stress?
Yeah, listen, I think, that if you focus on things, again, that you...
My suit is on. Hey, Denti Pro.
Oh, I didn't see that. Oh, there we go. Yeah. So I'm going to focus down there to see all our mates that are friends that are joining us. But yeah, listen, I think if, again, we go back to what I said, is if you focus on doing or getting better at the stuff you really enjoy and
Yeah.
you're good at, yeah, then you're going to take away a lot of the stresses in practice.
Yeah.
You know, I mean, for instance, you know, I used to look at my list, my day list, when I used to come in 10, 15 years ago. And for instance, I would see maybe there was an endo. I have an endodontist working with me who's just the most important person in my life.
Right.
And it would stress me out because, you know, that was something I felt uncomfortable with doing.
Yeah.
You know, whereas when I see a patient who needs veneers or something like that, that's what I love. And so that makes me happy. So I think this is an important thing for sure when it comes to stress in our practice.
Yeah, I think that there is the stress for especially young dentists, and especially in the United States, coming out with a lot of debt, and they feel the need to keep everything in-house because they need the money is really what it is. And so it can be difficult when you're doing endo, and then you're doing extraction, and then you're doing scaling root planing, and then you're doing veneers, and then you're doing crown and buildup, and it can be difficult, I think. But I know a lot of dentists are like that, and it's becoming like the super GP, right? And I think there's something to that, right? Like Christian talks about, the super GP should really be the best treatment planner. They don't necessarily have to be the best treatment provider for all of those. Right?
Yeah, no, I agree. I mean, there are two things that I'll take from that. The first is that, you know, although we set ourselves goals that we want to just do endo or we want to just do implants, you know, you have to understand that this is the plan. It's not going to happen tomorrow.
Right.
But if you don't have goals and have plans, you know, it's just not going to happen. So, you know, you have to understand that it might take 5 years, it might take 10 years.
Yeah.
But if you don't put those things in place, you know, and you're the only one that can do that, these things don't happen. And, you know, and the second thing that I 100% agree on today, that's, if I look back at the mistakes I've made in dentistry, was exactly what Christian said, and it's about planning. You know, is that I never planned that case well enough. You know, that I didn't sit down. I really started treatment and I got involved in things without really understanding about the objectives of what it is, what I was trying to do. Yeah. So planning is something that is really underestimated, and in terms of the importance of it. You know, in terms of what our patients, and I think going forwards, I mean, you know, there are a lot of things that our patients will look to and look at practices and think, and that's what I emphasize, is that why are we better? Because we plan better, you know, as a practice, as enamel.
Yeah.
You know, we don't just decide, book an appointment and let's get started. It's like, slow down, let's get a good plan, you know, and then we're going to move forwards.
Yeah.
So planning is like super important.
You're exactly right. When I think back of all the patients that kept me up at night, and that, you know, at one point almost made me quit dentistry, a lot of it had to do with kind of getting started quickly, right?
Rushing.
And some of that came from the patient.
Yeah.
And my problem was that I took their lead instead of saying, hey, let's slow down. You know, we all have these patients, right? They come in and they say, you know, I need to have this done in 2 weeks. And you're like, that may not work because we have to do this first and we have to do this first. No, have it done 2 weeks. Here, I'll pay extra if we can do it faster, right? And I think for all the dentists coming out of school, you know, they're thinking like, okay, cool, I get to do this cool treatment. I get to make money, and, you know, I can make this patient really happy because I'm better than all these other dentists, right?
Yeah.
And I think the other big mistake that I made was when a patient would come into my practice and they said that they had already been to 2-3 other dentists, and my ego took over and said, well, I'm better than these other dentists, so I'm going to be the one that makes you happy now. I didn't realize it wasn't the other dentists.
No, exactly. And I think that more and more that our patients see us spending time in deciding what's best for them, the more they will put their money in our camp, or they'll vote in our practice as the best. I have a great saying when patients like, they want me to make a decision right now about what we're going to do and when we're going to do it.
Yeah.
I tell them, like, slow down. And they say, what do you mean slow down? I say, I'll tell you why. Okay, right now is that I'm definitely going to give you the best treatment. They look at me and they say, why? And I say, well, because we're going to do the least treatment, but give you the best result. And they're like, wow, that's exactly what I want to hear.
Yeah,
The
I
least
love that.
treatment with the best result.
Yeah.
Because that's really what they're after. And then they understand that, okay, this is a process. So, and that really works, I have to say. But yeah, planning is the key. I mean, I've got more disciplined over the years that I'm not prepared to start treatments without the right planning in order to guarantee that you get the best result, because that's the key, you know, it's consistency.
Yeah, and I think that's really what DSD did for the world, right? Of course, you know, DSD originally was thought of as like for veneer cases, okay, like for aesthetic cases. But now, going past that, when you look back on what it really did for our community, was it it recommended or showed the advantages of what happens when you take the time, you get all the diagnostic information. Then you get the team together, you decide on what's possible, treatment options, what's going to be successful, what's not. And then once we decide what the treatment is, we go from the end backwards, whether it's veneers, whether it's implants, whatever, orthodontic. And when I look back on my journey with DSD, that was really what it changed for me.
Yeah. Yeah, no, I 100% agree. And I think that, you know, again, I think it was Christian that made the comment, is that, you know, we're all human and there are mistakes that can be made.
Yeah.
But isn't it a beautiful world if we can make the mistakes on the computer and not in our patients? I mean, isn't that a great concept?
It's,
you know, let's make virtual mistakes. Let's not make mistakes with our patients.
Yeah.
So let's plan the case really well. Let's find out where the challenges are, and let's then sit down and do the treatment in a methodical way, in a predictable way, in a guided way. You know.
Right.
And so that the DSD really opened my eyes. I was a kind of early adopter at my age, which is a great thing.
Yeah.
And I've been on the full kind of journey. And, you know, I think, in all honesty, if I hadn't seen the value that it allowed me to work in my practice in enamel, I wouldn't be doing it today. I mean, I'm now, honestly, I think 8 or 9 years down the line.
Yeah.
And we do it. And I work with Howie on a lot of implant cases. And
you're pretty lucky.
Yeah. Do you know that I started placing implants back in '94?
Wow.
And yeah, that's crazy. And so yeah, it became very difficult for me now to continue placing implants because I have that guy over my shoulder. You know? Yeah. So it's a great thing, and it's again what I was also talking about. Focus on what we like, and then surround yourself with a great team.
Right.
Because this will make your life easier and better and more rewarding. You know, it's about teamwork. There's no question.
Yeah. Yeah. What I always
in
say,
life in general.
Yeah. What I always say to that point is for my young doctors or my students, they say, you know, what should I do when I get out of school? And what I say is when you get out of school, oftentimes you're not buying a practice right away, right? So you're working for this person, you're working for this person, you may work for a year with them, you know, 2 days a week with this person. Learn what you like and learn what you don't like too. And also those are the best places to make your mistakes. I mean, it's a shame to say that, but you know, you're going to make mistakes. And so the time to make them is early on in your career and learn from them later.
And learn from them and learn from them. You know, I have another saying, you're like, the best dentists are the best planners and only make the same mistake once.
Yeah.
You know, I mean, learn from those mistakes. You know what I mean?
Yeah.
Don't push them to the side and pretend they weren't there. You know, be critical. We have to really kind of police ourselves in dentistry. You know, we have to be, you know, because no one really is looking over our shoulder all the time.
Yeah.
You know, we have to be honest, I think.
And I think what's nice is that I see this happening more in the speaking community just in the last 3 years. Before that, it was all this podium dentistry, right? Let's
Yeah.
show how good I am. And when
Yeah.
I first started
No,
speaking, that's what
you're
I
right.
felt like I had to do. All I did when I first started speaking was look at how good my cases are, right? Look at why I'm better than you and I'm up front here talking and not you. And then what I realized was that, you know, I saw people speak like I always give the reference of Joseph Kahn because he always shows
Yeah.
his complications. And now I see so many speakers showing complications, and I love that because now our community is really going to start learning not only from our own mistakes
No,
but from each other. And as a speaker, you know, I have a lot of my complication cases that I show. Those are the cases, and because I keep talking about them, I keep learning from them over the years. And sometimes I'll show, you know, this is what I did and this is what I think went wrong. And someone may raise their hand and say, you know, did you do this? Because that could have been why this went wrong. And, oh, yeah. And I can even keep learning from these mistakes.
Yeah. No, I mean, and you know, the thing that I would also say, and I'm sure that you realized this really early in your career, and obviously it wasn't available for us, is that, you know, we have to be able to self-analyze what we did, and photography is like one of the most important points in dentistry,
It's
because
so true.
you know, the moment is the moment and then it disappears, and really a patient, you can, you know, you can finish that case and it walks out and you didn't see even a fraction of what went on until you review the photographs. You take photographs and you have a look and you think, wow, you know, did that really happen? Or, you know, and photography is like such an underestimated part of our job, you know, and I think more and more, obviously, you know, those of us who have had the privilege of speaking and understanding about documentation have really, in my opinion, been one of the things that has made me honestly a better dentist, you know, is
So
looking
true.
at my work. Just looking at my work and thinking, wow, you know, I could do that in a better way, or did I, you know, small details.
Yeah. Pascal Magnier, my first mentor, he always talks about photography as his third eye, right? He can look at it with his two eyes. And then once he looks at it with his third eye, sometimes you see something that you don't see with your two eyes, right? And I had cases where I showed them on my lectures for multiple years, and finally people would post something out that I didn't even realize. Like there's this one case that I always focus on. It's a central incisor implant that someone else had done the implant, I had done the restoration, and we had some complications. And just like, I don't know, I was probably lecturing with it for 3-4 years, and someone said, hey, did you notice that the canine and the premolar are switched positions? I had no idea. I was so focused on the central incisor, I didn't even see the canine and the premolar switch.
Yeah, I mean, when I finish a lot of all my aesthetic cases, you know, that we have follow-ups, and really, I don't do any final corrections until I've analyzed the photographs, because what I see and what with my eyes, and my eyes are pretty good, even though I'm wearing these glasses, by the way. And what I see on photographs is really two different things. And so photography is an amazing tool. And, you know, I tell dentists, you know, if there's something that you really need to invest in, you know, and if it's Christmas or their birthday, ask for a camera.
So true.
Don't ask for a holiday or a car. Ask for a camera. You know, you will get so much value out of that in your career. You know, it's really one of the most amazing tools that I have in our practice.
Yeah, and I think that the mistake that a lot of people make, and I was like this as well, was I was only documenting the pretty cases, right?
Yeah.
And you have to document every case, because you don't know cases. You don't know which one is going to be the one that has the complication that you can learn from. Even the one that you're planning on being the pretty case. And that's actually how I got most of my complication cases was I was documenting them thinking that this is going to be the pretty one that I'm going to show on the podium. And then, you know, the implant fails, or there's an infection, or, you know, the porcelain fractures or whatever it is. And then I keep documenting, and then it really becomes a learning lesson for me and for anybody that I can show it to.
Yeah, no, it honestly changed my kind of perception on how good I was. First of all, it
Yeah.
brought me down to earth sometimes. You know, I
Yeah.
had this understanding that I was probably better than I really was.
Yeah.
And then it slowly kind of made me a better dentist. You know, that's what happens. It's quite brutal sometimes.
Right.
You
So
know, when
someone's asking us to share our camera settings. So I'm going to talk.
oh wow, okay.
That's
So
kind of
I think that,
involved, but yeah, go ahead, Mark.
okay, I'll give you my perception on kind of dental photography, and I say it, and I kind of I break it down and say, you know, dental photography is very simple, because really, you know, I think we have to focus on just two settings: extraoral and intraoral.
Yeah.
You know, and that's it. Once you work out your intraoral settings, then you stick with that. I don't know about you, but you know, it's very seldom that I have to do anything different on my camera for an intraoral picture versus an extraoral picture, because I have the two settings that I've worked out.
Yep.
And we stick with it. So just to go through this quickly, I mean, I think that we shoot manual.
Mm-hmm.
I'll go through my settings and then we'll see yours.
Sure.
So my ISO setting is 125. My shutter speed is 125.
Mm-hmm.
And my f-stop for intraoral is 28,
Mm-hmm.
and my extraoral 14. And then I'll vary the flash power depending on the battery of the flash. I mean, that's what I'm going to change. So that's my kind of setup. I don't know about yours.
Yeah, so mine's a little bit different. I think from where I started was, you know, get any camera body. The body is really the least important part of it.
The least, 100%.
And you can get something on eBay that is used, that is even 5 years old.
Guaranteed.
And it will be plenty for anybody getting started. You know, get like I don't know, a 105 lens, Sigma.
Macro.
Yeah,
it has to be
a macro lens.
Macro.
You know, and you can get them relatively cheap, but I would say where you're going to spend the money is going to be on your lens. Okay. And you can use that for everything, right? You can use that for posterior, you can use that for anterior, you can use that for portraits. Now, they all might not be the prettiest, but if you're getting started and you want one camera, that's the one to get. And you can get a ring flash, right?
And a ring flash.
Sigma, it's really a dual point, but a dual point ring flash. That's a great starting camera, and that can last you for years. Now,
definitely.
If it's become more of a hobby, or if you're doing it for lectures and you want to make things really pretty, then things can really change. So we got sick of kind of changing flashes, changing lenses, and you know, there's 3 doctors in my practice. So we actually have a separate camera for posterior, a separate camera for anterior, and a separate camera for portrait. And that's really just because we take hundreds of photos a day and we don't want to be changing lenses. You don't have to do that. But we actually mostly shoot on aperture priority. This is just how I was taught by Dr. Manier. And so just like you were saying for aperture, you know, he always said kind of the highest number of the aperture. Okay. So the smallest aperture you can get, because then you won't lose any information, right?
Yes. Depth of field.
Yes. You get that depth of field.
So the front teeth and the back teeth are in focus.
Are all in focus. Yeah.
100%.
So, you know, for now, like our posterior camera setup is basically, I think it's, I don't even look at it anymore, but I think it's a 105 macro with a ring flash and whatever body. And then our anterior one, gosh, it may be a 60. I don't even remember what it is anymore. But then we call it the bat camera with
twin flash.
The twin flash
and
reflection.
The diffusers.
Yeah. So and then for our portrait, we actually use just a ring light, and we use the only flash that we have is actually in the back of the patient. And this was something that I learned.
No,
no, we don't, because we don't have space.
Okay.
Our whole office is about what is that, like 100 square meters?
Okay. Wow.
So
Yeah.
pretty small.
South Africa, we have space.
Yeah. See, we have no space in Beverly
We
Hills.
have a lot of space.
Yeah. So
By the way, you need to come and visit us when this whole thing is like
yes.
gone. You
Yep.
need to come to Cape Town. And anyone else who's on this like this little live feed, please, you're all welcome to my practice.
I would
Veneers,
love
come and say
to.
hi.
Yeah. No, South Africa is top on my list. I have Japan and South Africa as the top two. So
Oh wow. Okay.
yeah, so I
yeah,
would
in
really love
our
to.
practice we have a similar setup. We have cameras in each surgery because
Yep. Yeah.
once you realize the value of photographs and I mean we're up, I don't know about you guys, we're able to charge our patients for photography. Are you allowed to do that?
No,
Yeah.
I don't know if we're allowed to. We don't. But
We
that's
do.
Oh, that's
We
great.
do.
Mm-hmm.
And you know, here's an interesting fact is that to date, there's two things that our patients never complain about paying for.
Mm-hmm.
Photography
Mm-hmm.
and Rubberdam.
Yeah, interesting.
They complain about radiographs, about
Sure.
a lot of other things,
Yeah.
but they've
I
never
say-
complained about photography. They see that we obviously care about their case.
Right.
You know, that we're paying attention. You know, maybe in practices that don't do it, it's an added value they see. And, you know, obviously Rubberdam speaks for itself, you know.
Oh yeah, we're very big on Rubberdam, and
Yeah.
people always say that, you know, you can't get high-end patients to do Rubberdam, right?
Yeah.
And I would say the exact opposite.
No, the opposite. Really.
Once you explain it to them,
Yeah.
they say like, why isn't everybody doing this?
Yeah.
You mean, and
No,
then sometimes they'll say, you mean people do it without this? It's
Yeah,
like,
yeah.
yeah,
They often,
it's a
if they've
value
had it,
builder
they'll say,
for
why
sure.
aren't you, where's the Rubberdam? You know,
Right.
I mean, what's happening?
Yeah.
And then
They're
I have
like,
to
we're taking
explain
an
this
impression.
procedure.
Yeah.
Yeah, we're doing an intraoral scan or whatever it is, you know, and so, you know, I mean, I suppose another interesting topic to talk about young dentists is technology and kind of, you know, where it's going. And, you know, I think that's a kind of difficult space, especially in the current climate. You know, I think technology is amazing, but again, through the DSD group and through our chats, I mean, I think, you know, technology is something that we have to understand about limitations. That still, you know, we as clinicians really have to be the ones making decisions, not the tech.
Right.
I mean, I think this is a great concept that we have technology to help us, not to make decisions for us.
Yeah. Yeah. Well,
know,
like,
and-
you know, like Christian always says, if you're a bad dentist with no technology, you're still going to be a bad dentist with technology, right?
No, yes.
The technology won't make you a great dentist, but it can make things easier, more predictable, streamlined, faster, cheaper, you know, whatever it is.
Yeah. Yeah, no, listen, it's changed definitely our practice. There's no question of how I perceive, you know, treating patients with whatever it is. And we're fortunate to have CBCTs and intraoral scanners and all of those things. But I think we have to still understand about the case itself, you know, not just throw technology at a problem and expect a solution to come out the other side.
Right.
You know, I think that we need to understand when we use it and how we use it and the benefits of using it. I think this is still a little bit of a gray area, and it's changing quickly.
So give me your kind of technology stack. What are you using right now?
So
as far as
in
intraoral
practice,
scanner, do you have printers?
So we have intraoral scanner. We're using 3Shape. Without talking too much about brands, because I believe that there are a lot of good scanners on the market.
Sure.
But we have a 3Shape scanner. We have a cone beam in our practice, you know, and we're a relatively small practice. And I think that's the other thing that I think that I don't know about in America that has to change quite quickly, and is the understanding that dentistry can be done on our own. You know, we really need group practices. You know, I don't know what the right number is. You guys have got 3?
Yeah, there's
You
three
got
of
three?
us. Hmm.
Yeah, we have three in our practice.
Yeah.
Obviously, there were a lot of practices, and it still today in South Africa, there are a lot of practices of where dentists are sitting on their own. And I
Yeah.
think, this is a big problem. And the sooner that they can all realize that, they need to find their partners. Even I say to them, what I would do if I was you is I would look at who my opposition is and then join with them. And say,
Right.
God, let's get together, because, let's then take out the opposition, because we are the
Right.
opposition.
Yeah. Right.
And then we can share the overheads, because on their own today, you can't run kind of a tech practice. It's not possible. The financial investment is not there.
It's a lot.
It is a lot, but the moment you have three, or whether it's 4, 5, 6, I'm not sure. I think it's probably more than three, to be honest with you.
Yeah.
Yeah, it makes common sense to have this technology, because it helps us,
Yeah, I think that's right. And you can divvy up some of the managerial aspects of it too, which is the part that I think most of us don't like, or the part that most of us are the worst at, right? Because most of us are artists. We like to work with our hands.
No,
Many of us didn't get into this to be business owners. That just kind of has to happen, right? You become a business owner and learn as you go.
You learn the hard way.
Yeah. So do you guys have 3D printing in the practice?
We don't have a 3D printer, but that's something when I get the opportunity to get back to my lovely practice, and I can't wait, by the way. This is my first day.
Yes, day one.
Yeah, we'll definitely add a 3D printer.
Yeah, I think that's been a big change for us, for sure.
Yeah, that's the next thing that we will add. And also, we run a big restorative practice, so probably a milling machine. We will have a milling machine. And mill whatever provisionals, those sorts of things, mock-ups, lots of things. I think we can start to mill, or maybe the milling machine is obsolete. Maybe we're going to be printing everything. So
yeah, that's what I was just going to mention. I think eventually that's what it will be. I don't know how long it's going to take to get the printing materials up to the standard of the milling. There's some things that people are printing now, like mock-ups. I mean, they're of course they're printing metal now, but
and ceramic. I mean,
and ceramic,
but I think it's not cost effective.
Not cost effective right now, and getting that down to a level where a practice can buy it, may take a few years. But I think you're right. I think the important technology is going to be intraoral scanning and 3D printing. And
no question.
Yeah, and someone just said we print titanium. Yeah, I definitely print titanium. It's not cheap.
Metal's possible.
But oftentimes for titanium, that's really only for implant restorations.
So I mean, the only thing, sadly, we're not printing these days is money.
Yeah. Well, I'm sure the U.S. is going to be printing money after all of this.
But times will change.
Yeah.
But yeah, I mean, I think that the tech thing has really taken us, and I've enjoyed it. I have to say. It was a jump that you need to make with confidence, and don't kind of stay in both camps. Once you make the decision, it's a learning. You have to put yourself out of the comfort zone. There's going to be things that you're going to get frustrated with, but my feeling is that decide and be decisive.
Yeah.
And I go back to the DSD, and our concept is that, why digital? Because it's better. There's no question. Because it's also cheaper. There's no question that if I do things in a and it's more predictable. So there's lots of benefits of doing it. It's not just that it's fashionable.
Right. Yeah, I think for me it's the predictability. And it's the ability to do all that digital planning. Before I had an intraoral scanner, and I think we've had intraoral scanning now for 5 years maybe, but before we had that, I would
Yeah.
see, you know, Christian and others, many of our friends doing this digital planning, and I
Yeah.
wanted to do that so bad, but I didn't have the ability to do it.
Yeah.
So what we were doing was taking intraoral impressions, traditional impressions, sending it to a lab that was scanning it, and then we could kind of get our patient into that digital workflow. But once we could at least scan, I mean, just the scanner is very, very important. Then
yeah, no, it's an essential part, but I mean, I still think.
I want to show you this. My wife is
Yeah.
trying to get my attention, right? So then she's
I
talking
saw
to me,
that
so I
someone was
didn't
trying
really
to get your
understand yet.
attention.
Yeah, and then she puts this massive spider.
Spider. Yeah, listen, in South Africa, we get a lot of those things. So
Yeah,
I
in
wish
South
I
Africa,
could come over to your place.
This is probably
and
not
help
a massive spider to you. Okay, so Mark, let's keep talking. I'm gonna go kill the spider. I've got this on.
Oh my God! Let's listen. I think for all of us who are on this live feed, let's hope that Carl joins us in a few minutes' time. I mean, this is going to be
yeah. If I don't make
because
it
if he
back,
doesn't, I'm not sure I could know what to do next. But yeah, I think that from my side, the digital workflow has meant a few things that we talk about. You know, better, faster, cheaper, and you know, is it better? I think better is the focus, but the fact that it's faster and cheaper is really an amazing benefit to us and our patients. So you know, that's really the take home from the digital side of things.
Yeah, and sometimes I made it back.
Oh wow, well done.
Thank you. Makes me feel like a man. Hey,
Miguel.
Hey, Miguel. I feel like I don't do an IG live where somebody doesn't mention Miguel or slow dentistry
my God, listen,
or something
slow
like
dentistry.
Yeah.
We're doing dentistry so slowly. We're not doing it at all at the moment.
It's true, you know, and having Miguel on too, for us, our slow dentistry is a selling point to our patients.
Yeah.
And I think there's some dentists that kind of advertise that they do it fast, and that's good.
Yeah.
And there's certain things that are good to do fast, right?
Yeah.
Like one thing I try to explain to my patients is when we do guided surgery, you know, and we do an implant in, I don't know, 20, 30 minutes, start to finish, right? Anesthesia, everything. And they're like, gosh, that was so fast, you know, but it was so expensive. And you have to talk to them about, well, I could do it fast here because I did it slow in the beginning.
Yeah.
You know,
and you spent your time on the planning, you know, like behind the scenes,
right?
You know,
I always say
that's where the money was spent.
That's where you spend your time. Yep.
Yeah, of course.
And that's where you want to spend the most time, because your chair time is the expensive time. That's the time when your patient is numb, bleeding, sedated, nervous. You know, they don't want to be in your chair as long as possible. They want to be as short as possible. So anything you can do outside of the mouth is so important.
And that's the beauty of the digital world we live in, because, you know, I mean, I have a designer who does a lot of our designing, and I joke because that's all he does. And I'm sure that he's mostly lying on the beach while he's doing his job.
Right. Good for him.
Yeah, good for him. I agree. So we can use our time constructively, you know, rather than doing all the stuff we can plan at home. We can plan wherever it is, because we have this virtual concept of what we're trying to do. And you're 100% right. And the other thing that's amazing is that, and this really drives it home to me, is that, again, you know, without saying that Howie's, you know, because I know that you may be the better than Howie, or Miguel's better.
No.
But anyway, Howie is one of the guys I think can place implants. Yeah. You know, with precision.
Yeah.
But surprise, surprise, do you think he does it with guides or with his hands?
Right.
He does it guided.
Yeah.
There's one of the best guys
in the world.
You know, But he uses guides. I'm not saying that he does it absolutely every time, but he does it wherever he can. He would rather place an implant with a guide than with his hands.
Yeah.
You know,
yeah. One thing that I always say, because, you know, I really just love guided surgery and guided dentistry in general, guided preps, everything, is once you get into, again, where the patient's nervous, numb, bleeding, whatever it is, all you're doing is executing. You're not making any decisions at that point, right?
100%.
You're not deciding, oh, do I want to go a little bit more mesial, or how close am I to the sinus, or, you know, where's the screw access hole going to be? No, all you're doing is going, putting in the drill until you hit the drill stop. The only thing you're thinking about is, am I going to get primary stability as far as implant wise goes? And it's the same thing when you're prepping for veneers, right? If you've done DSD, or if you've done a traditional wax up or whatever, but you're starting with the end in mind, and you're prepping through the mock-up, you know what thickness the end result's going to be, if you're going to hit the tooth. I mean, all these decisions have already been made. You're only executing.
Tooth preparation.
Yeah.
Guided tooth preparation. I mean, and here's another one that you'll like and you can use. I have a saying that someone needs to guide the guide.
Yeah. Yeah, that's true.
Just remember that fact. Someone needs to guide the guide. But yeah, here's the deal. You know, obviously that's my kind of niche is veneers. It's you know, it's minimal prep. I think our patients want us to work in a conservative way.
Yeah.
You know, there's no question that and Pascal Magna, and there's a bunch of guys, Philippe, who were mentors that I've looked to, who have shaped the way I practice. But you know, there's no question that our patients want dentistry that's non-invasive.
For sure.
You know, and what is non-invasive? The mystery is no dentistry.
Me.
Is no dentistry. Let's focus on prevention. You know, that's still something that we mustn't lose sight of.
Yeah.
But yeah, I mean, I have not, and I'll tell you honestly, you know, today that I have not prepped a veneer case in the last definitely 7 years without a mock-up and without depth cuts and without guided tooth preparation.
Yep. Love that.
I changed that protocol a long time ago.
Yeah.
And understood that you know, that the only way that you can control tooth preparation is using planning. Much like any dentistry, you know.
Well, I think Galip Gurel and Pascal Magna were the people that brought that idea to the world, and really they saved a lot of teeth by doing that. When you think of
do you know that concept was 2003. Can you believe it? 17 years ago, and yet still today, I see dentists just picking up drills without any understanding of what they're trying to achieve
and going for it. Yeah.
And just like as they're going, they're trying to work out, you know, how much tooth to remove.
Right.
And that's it's a scary thought, and it's a mind shift, but you have to be disciplined and stick to it.
Well, I remember my third year of dental school when I was doing my aesthetic. It's called aesthetic selective with Pascal, where he selected 10 students or 12 of us and worked really close with us. And when he was explaining that concept, something snapped in me, and I got it. And he showed how, you know, when you go in and you just remove and not knowing what the end result is, you may removing tooth structure that you don't have to remove. Oftentimes when we're treating patients for veneers or whatever it is, they've already lost volume, or the tooth's in the wrong position, so you may not have to reduce. And when it clicked for me, oh my gosh, it changed everything. And now, you know, when you see people they come in, hey, let's do veneers, start buzzing.
So and here's an interesting thought, is that if you think about why digital is better than analog, you know, when it comes to tooth preparation, and when I say this, people are like, wow, I understand what you're saying, is that, you know, if you think about how we did it, and it was a great concept because that was the only way, but we used to put wax on a model. It was called a wax up. You remember those things?
Yeah.
And then we would put the wax up back in the mouth. That's a mock-up. You know that thing, obviously. And then we would prep backwards. But then I said, like, what if on a Monday, my technician put 0.5 of a mil of wax, and on Tuesday, he put 0.3, and on a Thursday, he put 0.8. Because this, and then I'm prepping backwards. These are going to have very different results. Do you understand? Yes, when you're working in digital, we know in our lab that if we're not changing tooth color, we put 0.3 on the cervical, 0.5 in the mid part of the tooth, and 0.7 towards the incisal, because those are the depths of the veneers that we're going to need. And so every time I put my depth cutter and I go backwards,
You know
I
where
now
you're
know
going.
exactly where I'm going to end up.
Yeah.
And that's an enamel.
Yep.
And guess what? What's the most important thing in dentistry?
I don't know what's that.
Enamel.
Enamel. Yeah, that's right.
Yeah, I mean, I like, oh my God, okay. And they look at me and I say, yeah, hang on. Let's remind ourselves, if your patients have enamel, most likely they don't need you unless they've got periodontal disease.
Yeah.
You know,
Yep.
because enamel what makes teeth strong and makes what teeth look beautiful. So
yeah,
that's why we called our practice enamel, by the way.
yeah. No, it's a great name, and I love the logo. It's a very
Thanks so
clean,
much.
very clean logo.
I was surprised that there were only about 6 practices in the world that were called enamel. It's like the most important thing in dentistry.
Right.
That's crazy, huh?
So we've got, about 5 more minutes.
Okay.
What advice do you have?
It's been a great conversation, by the way.
Yeah, no, it's been fun.
I forget to say that.
Yeah, I mean, the only time that I've been able to talk to you in person was when we were in Australia.
Yeah, in Sydney.
I think that was it. Yeah, a few years ago.
Yeah.
Any
I'm sure
other?
Our paths will cross.
Yeah, I hope so. I hope after all this slows down, we can get back to our lecturing schedule, right?
Yeah.
What other advice do you have for young dentists that we haven't already talked about? We've already talked about photography and going slow and picking your niche and practicing in groups.
Yeah, I mean, I think the one thing that I've had this conversation before, and I think probably if I look back at myself and where I've got, and Miguel and yourself and Howie and all of the people who I look up to and respect and look as my peers and friends, and I think what have we got in common? And there's one thing that we did is we educated ourselves. We learned to do dentistry in a better way, and I think education is one of the most important things as a young dentist that you can invest in. And in fact, forget about the tech, forget about, just educate yourself. Find out what you want to be educated about, and then invest in education. And I think that's a global phenomenon. I mean, if anyone who educates themselves must be in a better place. So in dentistry, if I was a young dentist today, I really would look at the programs, the facilities that would allow me to be educated and provide just that higher level of dentistry that patients are looking for. So education, I don't know if you have anything else to add. Education, and dedication, and hard work. Let's be honest, you and Miguel and Howie and myself don't sit here talking about this stuff because we were lucky.
Right.
It didn't happen. We had goals, we applied ourselves, and we had to make sacrifices.
That's true.
That's what life's about, is sacrifices,
Yeah.
So
that's
what I would say. Is that a fair comment?
I think that's a great comment. I think on top of that, to add to that, I would say to try to learn from people that are true educators instead of show-offs.
Showman.
Right? Yeah.
Yeah, show-offs.
Yeah, so
I agree with you.
The people that I've been able to learn from, that I really have learned so much from, are the people that have brought their egos down. And these are people that are, well-known, some of the best in the world, but you can tell who these people are, that when they show their mistakes, they give you real advice, not just kind of this fluff. They show their real cases. They talk really about their patient. They're open about, their practices or their fees or wherever. I think those real educators are the ones that make big differences. And, many of those people that I'm talking about are, our friends that we're on a WhatsApp group with.
Yeah.
So
and be conservative. Let's be honest.
That's totally true.
I mean, if I look back, and I think that the most important is be conservative. When you're practicing.
Yeah.
As I said, I always tell, I said to you, I try and do the least amount of dentistry, but to give my patients the best results.
I really love that. I'm going to write that down.
To be honest, that's what I tell them. And then I say, you know what? To give you the best result might be a full mouth rehab.
Right.
But I can tell you, I'm going to do the least amount of dentistry, and I'm going to give you the best result. And they look at me and they think, wow, that's just all I want to hear. I don't want to hear any bullshit.
Yeah.
I trust this guy now.
Yeah,
So
I love that. I'm
those
gonna
are
write that
some.
down.
I'll send you some more, by the way, if you want.
Yeah, you're the king
Of
of
these kind of
little
like, you know,
one-liners.
the one-liners that our patients need. You know,
Yeah,
they're super important. But yeah, I think education is like a super important thing.
great.
You know, that super, and back
Oh,
again.
I'm back.
But yeah,
Yeah.
anyway.
So,
So yeah,
Mark,
those are
thanks for
the
taking the
things.
time.
Yeah, no problem.
It's
And I
been,
mean,
I
if
think, a
you're
really good
wondering, you
conversation.
knew what this was?
I saw that. Did you hurt yourself?
Yeah, man. I won't show you the wound because that's probably
Collarbone?
like a surgical video. I fell off my bike yesterday.
Oh,
I,
yesterday. Oh, no.
yeah, the day before, yeah, I had like a high-speed crash on my road bike, and
Uh,
about 40 kilometers an hour. I hit the tar, and I removed a lot of skin, and
oh
I
my
popped. If you
gosh.
can see, this clavicle here has popped off the joint,
Ah,
and so. And so, I mean, here's the spooky thing is that, and I mean, you know, I felt quite guilty, but I had to go to the doctor because obviously I was I had a lot
right.
of problems with, you know.
Yeah.
And so yesterday he booked me off for 3 weeks, which is our lockdown.
Yeah. Good timing.
Yeah, good timing. But anyway, the other thing that I want to just say to everyone, stay positive, you know,
Yeah.
and don't spend too much time on social media on negative stuff. You know what I mean?
Yep.
Really focus on, you know, what's right around you. You know, we have 2 dogs. Focus on that. Your family.
Yeah.
Focus on the good things that you've achieved on in your practice. But seriously, you know, try not to spend so much time looking at all these negative videos and stuff. But, you know, yeah, just try and filter that out as much as you can, because
Yeah.
there are still some positive things that we can get on, and yeah, be careful about just spending all that time looking at your phone.
That's true. Well, great.
Is that good?
That's a great way to finish. Thanks for taking the time. I think
Yeah, it's
that
been a pleasure. I
this
have to say,
was
Carl, it's been a
really,
great.
really
It's been a
fun.
great. Wow, it's an hour.
I
My
know.
God.
Time flies when you're having fun.
Yeah, it's time for bed now. Actually,
Yeah.
it's happy hour here. I'm sorry for you. You
Oh,
gotta go
yeah,
have
I know. I've got
breakfast.
meetings all day. So I
All
think we got a
right.
lot of good advice for young dentists, new doctors, or
Yeah.
really anybody. And
Yeah.
so why don't
Yeah.
you just quickly tell where people can find you,
Okay.
whether it's Instagram or your office?
So yeah, I'm Doc Mark Bowes and Enamel Dentistry. You know, so if they want to look on Instagram, Doc Mark Bowes, pretty simple.
Right.
And Implant Aesthetic Academy
Yep.
also, which is in Cape Town, and Enamel Dentistry. You'll find a lot of my stuff. Yeah.
Cool. Well,
Yeah.
thanks, Mark.
So
Hope to talk to you soon, and hope
look
everything's
after
good in
yourself
South
and your
Africa.
family. Yeah.
Okay. Thanks so much.
All
All
righty.
right.
Cheers,
See you guys.
Carl. Bye now.
Bye-bye.